Hello, everyone. This is Dr. Rao, and today I have with me the Coordinator of Health Services for the district, Mrs. Lauren Reagan. And Lauren will be talking to us about how to ensure that we're keeping our children safe. Good morning, Lauren.
Good morning, Dr. Rao.
Good morning. So, Lauren, with our elementary students being in school now 2 days a week, would you please remind our families about the guidelines that they should be following before they send their children to school?
Sure. Families should continue to monitor their children every day. This should include checking their temperatures and checking for symptoms of any kind of illness, but especially COVID. And some of those symptoms include fever, difficulty breathing, a cough, sore throat, runny nose, a change in being able to taste or smell things, and any stomach problems, vomiting, nausea, or diarrhea. If you don't have a thermometer available at home to check your child's temperature, touch base with the school nurse in your building. She has some access to some material which we can look into providing you with a thermometer for your children.
Great. So if a child does have symptoms, any of the many symptoms, the cough, the fever, what should the parent do?
The parent should keep their child at home. They should call the school nurse and let them know the child's having symptoms. They can do this to let them know they're having symptoms and they're not sending them, but they can also do this if they are not sure they should send them or not send them. You can call your building school nurse and check in and let them know what's going on, and they'll give you some advice on whether your child should come to school or not come to school. If they do have a fever and they are having symptoms, you check in with your healthcare provider. If you don't have a healthcare provider, you can call one of our health clinics, our school-based health clinics. They're located at Washington Elementary, Carter McRae Elementary, J.P. McCaskey High School, and we have one Lancaster Health Center clinic at Reynolds Middle School. There'll be information about the phone numbers and the locations and the hours on our website.
Great. So I also want to reassure parents that we know that we have always said, send your child to school, but in a pandemic now, we understand and prefer that you don't send your child to school if they have any symptoms. If you notify the school that you're keeping your child home because you're worried about maybe them having symptoms, we acknowledge that. And so you would not be, your child would not be marked as an unexcused absence. That's an excused absence. And we are definitely taking that into consideration when we see that elementary children are not coming to school. So that's okay. It's better to be safe than sorry. So we also have a new dashboard that parents can look at to find out how their school is doing. Lauren, can you talk about the dashboard that's going to be available on our website?
Sure. The dashboard is on our website. It's under the Back to School page, and then it's listed under Health Data. The dashboard has the information arranged by the schools, by elementary, middle school, high school, and other areas in the school district. And what the dashboard will show you is how many cases, active cases, we have within the school district. What we consider an active case is anyone in the school district who's tested positive and who has been in contact with the school. If you look at our dashboard, we have had very few cases overall. But if you're concerned about it, that's the place to go and see how your school's doing and what the impact of COVID is in your school.
Thank you, Lauren. So for parents, when we put these notes in our dashboard, we are looking at positive cases of people who are actually in our schools, whether it's students or staff. So for example, if we have a staff member who's working from home and doesn't at all have any contact with other staff or children in the building, then they would not be part of that list because they haven't had any contact. So we want you to understand what this looks like. The other thing I really want to encourage for our families is our elementary students are in school just 2 days a week. And right now, our secondary school students will not be coming in until at least January. But we want to make sure that when that time comes, whether for elementary or secondary, for us to bring in more children, to bring them in for more days of the week, we need our families to cooperate. And that means making sure that you're wearing your mask and keeping social distancing when you're out in public, and of course, washing your hands frequently. With the holidays coming up, it's going to be really important that we remember those things, because what we don't want is for our children to come back and then, demonstrate illness. We've been very fortunate. We know our schools are very safe. We have all the mitigation we're supposed to have in our elementary schools. So we, like you, want to bring our kids back to school, but we do have to be sure that our students and our staff are safe. And we appreciate your support. So thank you to Lauren Reagan, our coordinator of health services, and to our parents for your tremendous support. Thank you.
Thank you.